Professor Mohammed. Okay, it's not okay.
Don't put the table tennis champion of the world.
Thank you very much, sir. That's another cap that our guy is wearing.
Current champion.
Current champion. Even though we know that Dapsy will not just. Thank you. Okay. The executive director, Professor Mohammed Lawal Atunga, other members of INC on stage, our guys, the HOPs, HOUs, and other the administrators that are here, and every other members. I want to, on behalf of the executive director, welcome you all to yet another episode of our seminar series. And the title for the seminar series today is Silent Struggles, Appraising Mental Health Realities and Support in Nihort. Before we go to that, permit me to make proper introduction now. We have the executive director and the CEO of our great institute in the hall today, in person of Professor Mohammed Lawal Atunga. Please put your hands together. Members of IMC that we have here present, we have Director of Research and Chairman of Research Review and Planning Committee, Dr. O.A. Adetula. Also here present is Dr. H.A. Akintoye, is our Director of Research. We also have Dr. Mrs. O.O. Oyedele, she's the Director of Research. We have Dr. Mrs. S.O. Babalola, our Director of Research. We also have in the hall today Dr. Mrs. Dr. O.A. Okay. Welcome. We also have in the hall Dr. M.V. David, who is the Director of Administration. We have in the hall Dr. F.B. Olaje Tayo, who is the Director of Research. We also have Dr. We have Miss. Okay, we have in the hall. Sorry, I just want to skip those that are not in the hall. Sorry. We have also in the hall Dr. H.N. Ibekwe. Thank you very much, sir. We also have Dr. I.O. Amao. She's the Transfer Director and Head of Planning, Monitoring and Evaluation. We also have in the hall. Okay, we have Dr. L.T. Olajujoy. Okay, also in the hall we have Dr. A.G. Adebayo. Thank you very much. We also have Dr. B.O. Ibitoye. We have Dr. Olufumi. You're welcome, sir. We also have Dr. Shukali. Thank you very much for coming. Can we please put our hands together for them? Okay, next in the program, we have introduction per se about the seminar. And as I said, the seminar today is on silent struggles, appraising mental health realities and support in Nihort. We have today the seminar chairman, who is also she's here, and I look at Madame this morning while she was coming. I say, what is all these people using that they are looking younger than we know? So please permit me to call Dr. Mrs. M.V. David. She's the chairman of the seminar. You're welcome. Then we have a citation, we have the presenter, and of course, when we have heard the title of the seminar today, and of course we know what that really means. So that will be taken by no other person than our own nurse, the one that everyone in the institute knows as our nurse, Mrs. O.A. Ajade. Thank you very much. Also, we have a citation reader for today, Mr. Samuel Daniki. Okay, thank you very much. Please take your seats aside. Thank you. Then the rapporteur for today is Mrs. Olakomi Beju. Please put your hands together for her. Thank you very much. Next, we have Chairman's opening remarks. Madam Chairman.
Thank you very much. Permit me to welcome again, especially our father in the house, the Executive Director, CEO of Nihort, in person of our own Professor M.A. Atonda. I also want to especially welcome all IMC members for creating time to be at this seminar. You are welcome, Mas and Sars. I also welcome the HOPs, HOUs, and all staff here present. You are welcome. Yes, before the opening remark, even though I'm my organ's boss at this hour. But permit me to give honor to whom honor is due. Let's listen to him to give us one or two.
Yes. I was thinking British now. But it's okay. You see, it's the champion that you talk. Yes. I'm still any champion or say any of the directors of the meeting. So the competition is left open now. I'm waiting for any challenger. Yes, people have gotten credit. You said the guy did not allow me to beat him. I want him. Either I allow me, he doesn't allow me. It's not my problem. Me, I have won. I think this is just a summary of what we are here for, mental health. You see, if you don't have money, you know, you have to make yourself happy. It is a matter of choice. And we choosing now to be happy and to make ourselves happy. These are the work balance. So I will return it back to my boss for 30 minutes. So this section should not be more than 45 minutes. So I have a boss for 45 minutes in Dr. David. I believe I'm having boss, all the MC members also having boss for 45 minutes. So the MC, I hope you will behave yourself so that 30 minutes or 45 minutes will be 45 minutes. So I welcome you to this sitting. I'll return it back to Chairman to anchor the program. And I wish ourselves a pleasant listening and presentation. Thank you.
Thank you very much, sir. Yes, my remark is that this is about the third time we'll be having a talk on mental health. And I would like to say that mental health seminars are valuable investments in any organization. And this is an indication that the Executive Director and the IMC, they actually value our well-being. When you say an organization that prioritizes mental health of the employees, it shows that the employees will be able to perform their jobs more effectively, and it will also lead to enhance productivity. So, like we have seen the topic, silent struggles, appraising mental health realities and support in Nihort. This topic will enable us to recognize our struggles and also be able to provide support to our colleagues who may be going through one challenge or the other. So I would like to implore us to be very attentive and follow the presentation so that we can, at the end of the day, benefit a lot from this presentation. Once again, I welcome every one of us. Thank you.
Thank you very much, Madam Chairman. Next, we will take citation, and citation leader is Mr. Samuel Dadik.
Good morning, everyone. I would like to read the citation on Mrs. Olukemi Adebawo Ajagbe. I was waiting. I wanted to call on her, but she had come already. You know, if someone can order mother around. But for now, she's here already. Yeah. Mrs. Olukemi Adebawo Ajagbe was born in Ibadan on the 13th March 1996. 1966, sorry. Sorry. That was the first year for coup d'etat in Nigeria. Into the royal family of Pa and Mama Felix Adenola Oshinloye of Odiremo, Ogun State, Nigeria. She had her early education from Methodist Primary School to Ekotedo and Isaba. Let me remove this thing. And Isaba Tudin Girls Grammar School between 1971 and 1983. She then proceeded to the School of Midwifery, Oluyoro Okiofa, Ibadan, from the year 1984 to 1987. School of Nursing, Osogbo, Osun State, from the year 1989 to 1990. University of Ibadan, Department of Nursing, from the year 1995 to 2000. University of Ibadan, Department of Teacher Education, that's the year 2007 to 2011. Limpark Computer College, 2003. I doubt if she still knows how to do that. Tosila American University, 2014 to 2017. Mrs. Olukemi Adebawo Ajagbe is a seasoned nurse with over 3 decades of dedicated service in the nursing profession. Thank you for that. She stands as a pillar of excellence, compassion, and resilience in healthcare. Her extensive experience spans clinical practice, patients advocacy, mentorship, and healthcare leadership. She has demonstrated unwavering commitment to the improving patient outcomes, upholding ethical standards, and inspiring the next generation of nurses. Her wealth of knowledge, gained from years on the front lines of care, continues to impact lives and elevate the standards of nursing practice. She has a registration as her professional details: Nigeria registered midwife, Nigeria registered nurse, BSc nursing, diploma in computer, PGD in education, MS nursing. I think she deserves an account. She has a work experience in Mark Clinic and Maternal Home Total Garden, Ibadan, from the year 1987 to for a year. She has a locum appointment for 3 months. Locum means a temporary appointment. That's used in medical terms. for 3 months in IITA, 1990 to 1991. Adeoye Memorial Hospital, Oketedo, 1991 to 1992. And she's still in National Horticultural Research Institute, Jericho, Idishin, Ibadan. That's from 1992 till date. Career progression. She joined Nihort in 1992 as a nursing officer and has risen through the ranks to the post of senior nursing officer in 1994, promoted to principal nursing officer in 1996, promoted to chief nursing officer on grade level 12 in 2006. She was promoted to chief nursing officer on grade level 13 and later promoted to assistant director nursing. She attended some workshops. They are outlined, but I'm just going to read few. Recent trends in managing tuberculosis and leprosy, overview of basic life support with emphasis on cardiopulmonary resuscitation, overview of renal disease with emphasis on renal, that's kidney transplant. And she has in-house on administrative practices, and she has management training on personnel relationship, conflict management, and resolution, amongst others. She has been an ad hoc committee member of CICS Electoral Committee, member Committee on Phone Theft, Chairman Committee on Administrative Question Bank, member Institute Welfare Committee, member First and Second Nihort Capacity Building Committee, Chairman Committee on Sports, and member Committee on National Guest House, Nihort Guest House, sorry. Community Service, Children Teacher in Bible Study Fellowship Information, Jericho, Ibadan. She's been a secretary at Mercy Clinic of All Saints Church, Jericho. She's among the women group of All Saints Church, Jericho, not men, women group of All Saints Church, Jericho. Sensitization of Esarun villagers at Ido on their health status. Thank you very much.
Thank you so much, Mr. Samuel. So the presenter has a special request. So she wants we want to recite the nurses anthem. So please, we are going to honor her. We are going to sing rather. So we are going to please honor her as we play the video, then we can sing along.
that transcends through every generation, immaculate and unbreakable. We are the source of hope to alien ones and the foundation for building a healthy world. Together we shall stand. Of caring and a feat of humility in service, we are called to your group. We are specially ordained for this vocation. Yes, I'm proud to be a nurse. From near and far, we have gathered with one goal to uphold the good name of our profession. L for neatness and splendor, U for understanding, R for responsiveness, S for selfless service, I for innovative and initiative, M for nobility, and G for gentleness and love.
Thank you. I think we should go to the presentation. That's all our time.
My able director, in person of Professor Elia Latonda, the members of the management committee, all my colleagues at work, and ladies and gentlemen, you are all welcome to this presentation on silent struggles, appraising mental health realities, and supporting Nihort. So I want to talk on mental health now, and by definition, mental health is a state where individuals can cope with life stress, you take cognizance of their abilities, learn well, and work productively, and also able to relate with his or her community. And WHO definition goes thus: mental health is a state of well-being in which every individual can realize their own abilities, then cope with normal life stresses, work productively, and contribute to the community. What am I saying in essence is that when you have mental health, you have a state of well-being in which you are able to realize your abilities in any environment in which you meet yourself, and cope with normal life stresses, like everything that can impact somebody's life negatively. You should be able to cope with it and work productively and contribute to your community. Not just the absence of mental disorders, but a positive state, encompassing emotional, psychological and social well-being. I want to tell you the brief history of workplace mental health. Initial focus solely was on physical health to the neglect of mental health, but the issue was slightly overlooked. And by 1915, the British set up a committee for the munition workers to impact concerning the long hours and fatigue, marking early interest in psychological effects on performance. So in 1921 then, National Institute of Industrial Psychology was created in order to address psychological challenges in the industrial workforce. Having realized that people working for long hours, they need to take their rest. Then by 1970s onward, there was stress recognition. Stress was given recognition. Increased discussion and research on stress was made, leading to initial mental health programs and policies in organizations. And presently, we dwell on holistic approach because we look at it from every side in order to have the prevention, the promotion, supporting, and full participation of individuals with mental health conditions. Then what are the causes of this mental work-related illness? We first look at the workplace stressors, in which we have high workloads. People are jam-packed with work. Then lack of control, in which the workers are not given the freedom to take autonomy on their work. Then job insecurity, whereby the people are afraid of layoffs. Then we have to look at the negative workplace culture, bullying and harassment in workplace, then lack of support if there is anything that arises among the workers, then conflict and negative relationships. It may be between the supervisors and the supervisees, or between the colleagues at work. Then other contributing factors are poor communication, lack of communication and active listening towards the subordinates. Then each of training and lack of training, and development. Then also unsafe working conditions. Poor psychosocial working conditions are significant contributory factors to mental health issues, and these include depression, anxiety, and burnout. How do we recognize these signs and symptoms? When somebody is having mental health issues, if it persists, it causes a red flag, which with mental health issues creeping in slowly, and it impacts various aspects of individual's life. So how do we recognize this? It's through the physical sign. When you look at the person, you'll be able to recognize the person will have fatigue and deep sleep disturbances. You'll be complaining, I didn't sleep well, and all these things. This may cause headaches for the person, headache, and digestive issues. Also, changes in appetite. The person may have a loss of appetite, or the person may be eating too much. Then psychological signs. What are you going to see? You can't see the psychological sign, but the person will be feeling it inwardly. The person will be having anxiety. The person will be depressed, irritable at any slightest thing. Then difficulty concentrating in what he or she is doing. Then memory problems. That is the cognitive aspect of it. Then in behavioral signs, you have social withdrawal. The person will not be able to relate with others as usual, and increased absenteeism. Also decreased performance in work productivity and substance abuse. The person may result into taking alcohol or drugs. So how this impacts individual? Impacts of mental health issues on individuals now. The emotional and behavioral. There will be excessive worry. There will be mood swings from happiness to sadness. In sudden change. Then changes in appetite, as I mentioned, stroke sleep patterns. There will be sleep pattern disturbances. Then cognitive function. Difficulty with thinking. The person will not be able to think well. Memory, at times the person may have memory loss or will not be able to read or remember what she has in upstairs. Then lack of concentration, impaired work performance. Then social and financial aspects. Social isolation, the person will withdraw himself or herself from the colleagues. And strained relationships, just because of the thing that is worrying the person may have a strained relationship with his or colleagues. Then healthcare costs, because of frequency of going to the healthcare in order to seek medical aid. Then lost productivity and quality of life and mortality also. There will be reduced enjoyment, hopelessness, increased risk of suicidal thoughts, reduced life expectancy. Sorry. How do we recognize this one? Organization. This thing that is worrying the person will have impact on the workplace or organization in which the person is working. And what are we going to see there? There will be increased costs in the aspect of healthcare. The person visiting the hospital frequently will be on his or her pockets at the detriment of her pocket. Then there will be lost productivity, there will be turnover. Then number 2 is the reduced productivity. Absenteeism. The person will absent himself or herself from work. And presenteeism. This one is worst more than the absenteeism. The person will be present at work, but will not be able to produce anything. Then reduced cognitive function. The person will not be able to perform well among the colleagues when they are asking the person, what are we? One must say, Onwiru. Then negative culture, that is reduced morale, strained relationships among the colleagues or even among the family members. Then increased conflict. Then the talent challenges now. There will be difficulty attracting and retaining top talents because the person will be visiting the hospital often and often may disappear from these things, and if the appropriate resources are not put in place, we may lose the person. An estimated 12 billion working days are lost globally each year. This is due to depression and anxiety. So how do we take action? We should look at it from the holistic approach. How? We should do prevention and protection. This is by implementing organizational interventions to manage psychosocial risks, like a flexible working condition. We don't have that one as such in our area here, but that one operates abroad, whereby the person you may give the person, instead of coming in the morning, the person can come in the evening, and the person may do his or her work at his or her own pace without any trouble. Then anti-harassment policies must be put in place in order to checkmate all these things. Then promote and strengthen. In this aspect, we train the managers to recognize and respond to distress. Foster mental literacy among all workers. The workers should be able to be aware of all these things in order to know the signs and symptoms and to take prompt action. Then support and accommodate. In this, we provide reasonable accommodations, like I mentioned, flexible hours for that person. The person may not be able to be visible in the morning, but you can schedule the time for the person to be at work, maybe by afternoon. Then return to work programs. After the illness, the person should be able to be reintegrated into the system. That is, you absorb the person back, and supported employment initiatives. Then creating a culture of openness whereby you raise awareness, you will be able to verbalize how you are feeling in the person you trust or you are comfortable with rather. So creating a culture of openness, providing resources for these people, somebody will say to unwind, because if the person, like the working fitness we are doing now, is part of the resources available. So you should be able to provide resources and implement, like the footballers that will go to the field and implement supportive policies. Implementing supportive policies are vital for workplace mental health awareness. We have frameworks for workplace mental health. The aim of this workplace mental health is to create an environment that prioritize and support employees' psychological well-being. And they also focus on creating a positive culture, addressing the potential risks, promoting resilience, and providing resources for employees facing mental challenges. There are some pillars of workplace mental health, and they are just 3. So a robust workplace mental health strategy is built on these 3 essential pillars. The first one is protection from harm. In this aspect, we should be able to identify and reduce psychological hazards to create a safe work environment. And 2, promotion of well-being. How do we go about that? We foster positive aspects of work, such as engagement, whereby when decisions are being taken in any organization, the members of staff must be included or should be included. And autonomy, you provide a free hand for the workers to do their job and purpose. Then provision of support. We ensure access to resources. Like I mentioned, you can play football, you can do working fitness, you do anything that will relieve that person of stress. And assistance for employees facing mental health challenges. Then there's need to create mental awareness. How do we go about that? It starts from our own society. It starts from our own society. There must be open conversations which must be encouraged. That is, you allow people to know by creating awareness, and you talk very well on mental health. Then there should be a reduction of stigma. Because in our own society, we just realize that anybody having mental injury, even at a place of work, they will look at the person. People will not be able to relate with the person very well. They will be stigmatizing that person, that don't move closer, this person, that one should not be. So there must be reduction of stigma, promotion of access to services, maybe right from the organization, maybe in which we have clinic, and you can make referral also. Then utilize community engagement by involving the people in the community and support networks. You leverage social media and digital campaigns, and advocate for policy changes and promote individual well-being right from our own society. And in our workplace, we should foster a culture of openness and support. Whatever you are feeling, please don't hide it to yourself. And if members of colleagues or the people at work should see this thing too, you should be able to approach the person and give the necessary support. Then provide resources and support. How do you do that? I've mentioned it earlier. Then implement policies and practices. The aim of this is to promote individual well-being in the workplace. We promote them, we give them the necessary support, give them the necessary support needed. Then this is what a mental health friendly looking workplace looks like. That is there, you should be able to, you should not congeal or reserve what is doing you. You should be able to speak up on this. Then employees are given opportunity to relax, you should have a place to relax yourself. You, the members of your the workplace or your colleagues at work, they should be able to rally around you and give you support necessary. Then there must be work-life balance. There must be life outside the workplace. When you work from Monday to Friday, by the weekend, please don't bother yourself. Just concentrate on your work and life and see to it too. Then, frameworks for mental workplace. We have two. We have US Surgeon General's framework, in which 5 essential things are being highlighted. And these 5 essentials are to protect from harm, through safety and security, opportunity for growth, that means in career development, training, and so on. Then you should do the connection and community, in which you should be able to socialize yourself with the people in your environment, not that you'll be withdrawing from there. You make use of that one and connect yourself to the community. Then work-life harmony. This should be that you be with your colleagues at work, you work together and do everything together. And mattering at work, you know that all the staff and the colleagues at work or anybody working should have a decent work. They should be able to verbalize their feelings. And in this aspect, we should have 4 things. DEI, which means diversity. We should be able to relate with anyone, not your own tribe alone, from Igbo, from Yoruba, from Cameroon, all sorts. And equity, there must be no discrimination. We should unite together in order to attend to the needs of everybody. And inclusion, everyone should participate and be included in all the decisions that are being taken. And accessibility, your leaders must be accessible to you. There must be no friction between you and your leaders. Then the another one is the Northern Territory Public Sector. In this aspect, there are 4 things. You should raise awareness by increasing understanding of mental issues. Then build positive experiences. You foster a supportive and inclusive culture, as I mentioned. Then you should be able to prevent harm and address and mitigate psychological risks that can affect anyone. Then early intervention and support recovery. In early intervention, you provide timely support for emerging concerns. Then support recovery, assist employees returning to work after mental health challenges, not to be stigmatized. This is the part of what I mentioned is the same thing. Then how to talk about your mental health at work. Talking about mental health can be daunting, very, very discouraging, but preparation empowers you. How do you do that? You first understand yourself, what you are feeling, what you are experiencing, and how all these things are impacting your work performance, even with non-verbal behavior. What exactly are you feeling? Number 2 is you consider the context and resources. You assess your organization's culture. Do leaders themselves discuss about mental health? Does your manager seem supportive to you? Then you prepare your comfort level. Look at the person you are able to relate with, that you can put your trust in. Decide how much you are comfortable sharing to that person to achieve your goal. This could range from a general statement to specific details. Then you start the conversation. You can be one-on-one. You can meet with your doctor. You can meet with your counselor. So all this impacts on your work, and if relevant, suggest how your manager can support you. Then mental health realities in Nihort. These are what I'm able to put together on study of mental realities in Nihort, and I use Nihort as a case study. The first objective is on socio-economic characteristics of people. So the first one is the age of respondents, in which we have 45.5% among those that are between 51 to 60. This indicates that these people are well advanced in age and well experienced as well. Then the sex of respondents, the males, they are 50.6%, while the female are 49.4%. There is no much difference gap. Then the marital status of the respondents, we have 80.5% among the married people in Nihort. This indicates the sense of responsibilities among Nihort staff, which shows that they have families and they have spouses and children. Then KEDAROS respondents, considering this, we can see that 79.2 is the highest among, and that is the non-researchers. And this one, the non-researchers are more than the researchers in this Nihort, which indicates that we have more supporting staff than the researchers. Then we look at the general well-being. That's the objective, the second objective, in which we have 63% among those people in the last 2 months that have not felt depressed and feel supported by colleagues at work. This is a better indication. This is a better indication, but there is still room for improvement. Then we have Nihort staff satisfaction assessment, in which we have 33%. In which we have 41% among those who feel their workload is manageable, and 33% here we have 71.4% as the highest, collaborating with colleagues, 67.5% learning new skills, and 64.9% having opportunities for career growth. This is a very good one, because there's still hope for staff insight on work engagement and mental health support. And when we asked what changes would they like to see, 83.3%, which is the highest, mentioned opportunities for training. And as you know, that training is key for improvement. And in this aspect, we are even giving booster to our director and the members of management, because we are trying to improve in order to see this one to be done. So they are seeing this thing, and that, as you know, that training is key for mental health. Then, in conclusion, support for mental health. Mental health is a shared responsibility between the employers and the employees. It is pertinent to know that creation of supportive and mentally healthy workplace by increasing employee engagement, reduced turnover, and improved overall well-being. Recommendations: creating a mentally healthy workplace is a shared responsibility, vital for employee engagement and reduced turnover. Tangible commitment: while expecting more support and opportunities for advancement from management, all Nihort staff must demonstrate their commitment to their work through action and resources. And in confidentiality, employee confidentiality should be upheld through clear policies. Supportive culture: mental health programs should be integrated into wellness programs to encourage help-seeking behaviors. Leadership advocacy: the HODs, the HOPs, HOUs should prioritize opportunities for training involve all members in department, program, unit, activities, and discuss mental health. By investing in mental well-being, we build workplaces where every Nihort staff will flourish. Acknowledgement. Now, onto the King Immortal. Now, unto the King Eternal, Immortal, Invisible, the only wise God, be honor and glory forever and ever. For he is my all in all. For he alone is my all in all. And to my ED, the Executive Director and Chief Executive Officer in charge of Nihort, in person of Professor Eme Atonda, I appreciate you. Thanks for giving me the privilege for this presentation. And I thank the members of the Nihort Internal Management Committee for presence here, for coming to see what I'm doing. And to my mama admin, in person of Dr. M.V. David, our mama, I really appreciate you because when she called me for this thing, I have prepared ever before to do a presentation, and I told her rather, and we had it. I give glory to God, and I thank you, ma'am. To my co-workers in person of Mrs. Olushola Shitu, Mr. Samuel Odanike, Mrs. Beju Olakomi, Mrs. Ronke Soni, Mrs. Kejike, Mrs. Fetwin Madubuko, and to my friends, Dr. Oluyemisi Adebisi Adelani, and Mrs. Wura Ola Osayua, who is presently absent here because of her health. Is presently absent here because of her health. And to the extension program staff, Dr. Oluyemisi Adewale, Mrs. Mercy Adebisi, Mr. Lukman Ajibade, Mr. Sunday, Mr. Drojaye, Mr. Ali, and many, and Mr. Zadik, I thank you all. And to the last and not the least, my husband and children for their immense encouragement and support. Thank you.
Let's appreciate the presenter very well. It's not easy to be an assistant director nursing. Yes, we want to appreciate our presenter for today for that impactful and educative seminar. And I want to believe that we have gained a lot from that presentation. There is a question she mentioned in the course of the presentation, and that is where I will start. That the staff should observe whether their managers are supportive. Yes, when I was giving my opening remark, I said something that the two capacity buildings we had before now, we had mental health talk. This is the third time. And what does that signify? That your managers are very much interested in your well-being. Let's put our hands together for the executive director and the entire IMC members. So this now means that we should not be quiet. The Yoruba will say that, you don't keep the hands that is paining you. You don't hide it under your clothes. If you hide it, nobody will know that you have any wound or whatever. Nobody will come to your aid. So the almost relies on us to speak out. Whatever struggles we are going through, please let us be free. If you cannot approach the executive director, you can approach me, any IMC members, your HOPs, your HOUs. They are there to see to our well-being. It's not only work. We want you to also be fine. We want you to be stable mentally. We want you to come to the office and do your work and go back home and still be useful to your family. We want you to live Nihort after retirement and be useful to yourself and still enjoy your life. So please, whatever the situation is, let's be free to express ourselves. We can even approach our nurse, tell her whatever it is that you are going through. And I trust God that there will be solutions. Thank you. Yes. I don't know, for the amount of time, I have put some things down, but don't let me just go over them again, so that we'll take our time. I know we have been impacted. So now we'll be going to our questions and answers and comments. And I would implore us to make it snappy. And I'll be starting from the high table. Now I told you earlier that as of today, I'm the boss of my boss. So please permit me to start. Let my boss ask his